This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Today's presenter is Dr. Marie O'Brien. Dr. O'Brien has been a healthcare practitioner for over 30 years. Dr. O'Brien is the current coordinator of the Mather Hospital Northwell Health Integrative Pain Management Program. As a nurse practitioner and clinical expert in the field of pain management, Marie is a published author of peer-reviewed literature that supports the use of non-medication approaches to alleviate suffering and enhance self-efficacy for people with pain. Dr. O'Brien's team are the most recent recipients of the CAT Center for Women's Health Innovation Grant, which is currently funding a program for women affected by cancer. Dr. O'Brien, the floor is yours.
Thank you, Jonathan. I'm just going to share my screen. I appreciate that very nice introduction. And just give me 1 second here. And slideshow. Okay, are we looking good?
Looking good.
All right, thank you. So I want to welcome everyone to today's HealthyU. As Jonathan mentioned, our topic is learning a holistic approach to managing cancer symptoms. I know that we had our disclaimer on as we were starting the program, but just as a reminder that this presentation is for information only, and our integrative care team here at Mather will always encourage our patients to consult with your own healthcare provider. Our interventions that are going to be discussed today are not intended for to diagnose, treat, or prevent disease. A healthy lifestyle and self-care will lead to overall health and well-being. The references for this presentation, the majority of them came from the NIH, National Institute of Health, and you'll see the links on each screen where the information came from. So you know this is valid and reliable information from a reputable source. We also encourage you, if you are seeking integrative and holistic approaches, to look towards the Northwell Center for Wellness and Integrative Medicine, which is located in Roslyn, as well as the Mather Hospital Integrative Care Program that is right here at Mather Hospital, as well as, most importantly, for anyone who has been affected by cancer, staying very close in close relationship with your own oncologist. So cancer and cancer treatment often lead to many unpleasant side effects and symptoms. Whether it's the cancer, depending on where the cancer is actually located, or the treatment that is being provided to the individual who has been affected by cancer. The different symptoms will vary based on what body system has been affected. Often patients will report that the symptoms from their treatment are sometimes worse, especially in the early stages of treatment. Sometimes the symptoms are worse than what they were experiencing initially from the actual cancer. And any symptom that someone experiences will be amplified or made worse depending on the stress that they're undergoing. And stress can be both a physical stressor. Cancer is a physical stressor on the body. It taxes the entire system. It leads to inflammation, and it leads to the person enduring the cancer diagnosis to be challenged with things like being able to eat nutritious food, being able to exercise the way that maybe they had exercised in the past. And there's an emotional stressor as well. And all of these can amplify a cancer symptom. So often patients or individuals who are affected by cancer will seek out what's known as complementary and alternative modalities, or sometimes it's referred to as complementary and alternative medicine. I like to refer to it as complementary and alternative modalities because typically many of the interventions, such as the ones we're going to speak to today, are not really medicine, but they're more so modalities or interventions that either a practitioner will provide for you. And most importantly, many of these modalities are interventions that you can learn and provide for yourself. And these types of interventions are sometimes preventative, not in the sense that it may prevent the cancer, but that it may prevent some of the symptoms that you may encounter, that the individual may encounter when dealing with cancer and its treatment. Many of these interventions or modalities can help to reduce stress, and most importantly, they can soften the side effects. Often we may hear from individuals that they may have tried an intervention. Perhaps they tried meditation or they tried aromatherapy or some of the other interventions that we'll talk about today. And they were a little frustrated because the symptom that they were experiencing didn't go away with the use of these modalities. So I do think it is worth mentioning that our goal is not always to eliminate the symptom or eliminate what you're feeling, but if we can in any way soften the impact, make it not so severe, make it more manageable. That is a realistic goal, and sometimes it may take combining several different modalities to get the best effect. So if we try one intervention or one modality and it softens the symptom, maybe it's pain or maybe it's nausea, if we can lessen it just a little bit, and then we layer on another intervention or another modality, and that may soften the symptom a little further, we can at some point get to a place where those symptoms are not so bothersome. So many times it does take time, and it takes a concerted effort of sometimes layering different modalities in order to get the best benefit. So what is integrative oncology? Integrative oncology is a patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and sometimes lifestyle modifications from many different traditions. And those are used alongside conventional cancer treatment. The goal of integrative oncology is to optimize health, quality of life, and clinical outcomes across the entire cancer care continuum, and to also empower people to either prevent cancer and become active participants before, during, and beyond their cancer treatment. And that definition came from the Society of Integrative Oncology. What is integrative care? So integrative care sometimes is something that people will seek out when they are trying to decide what else they can do that's in addition to their standard cancer treatments. Often patients or individuals will ask the question, how can I manage my side effects during and after my cancer treatment? How can I improve my quality of life? And people will often ask the question, what does the science say about the therapies that are part of integrative care? What does the science say about acupuncture, mindfulness, yoga, perhaps nutritional supplements? Integrative care, or the philosophy of integrative care, as well as integrative oncology, can help bridge that divide and help patients answer some of these questions that they may be seeking answers to. So why do integrative therapies actually work? And that's a question that many people will ask, and sometimes it's an elusive question. Sometimes we don't necessarily know why a specific integrative therapy may work, but we know that it does. And we know that it does because we listen to patients and they share with us that these therapies work. And that concept runs through the majority of these interventions that we're going to talk about today. When we look at studies for many of these integrative therapies, sometimes there are conflicting results or conflicting studies. And some studies you can look at the same topic, whether it's yoga, acupuncture, meditation, mindfulness, hypnosis, aromatherapy. And you can find many studies that are supportive of integrative therapies. And you can probably find an equal number of studies that maybe do not support an integrative approach. We need to recognize that sometimes many of the studies that we look at that are designed to identify the value of an integrative or holistic treatment, those studies are using the standard medical model to assess the effectiveness. So often you may look at a study or hear about a study or discuss with maybe a healthcare provider a study. And the healthcare provider may say to you, here's a study that has a randomized controlled trial. And it may sound very confusing, but in essence, a randomized controlled trial, for anyone that's not familiar with research, means that the people who participated in the study were by random chance assigned to maybe one of two groups, maybe it was one of 3 or 4 groups. And each group in a random way is then given a certain intervention or no intervention. So the challenge, and then the results are then measured. So if we're talking about perhaps acupuncture, if we're looking at a randomized controlled trial for acupuncture, patients will be randomly assigned to maybe 2 or 3 different groups. One group perhaps receives no treatment. Another group will receive the real treatment. They're receiving acupuncture. And maybe another group is receiving something that is called sham acupuncture, or something that's supposed to resemble acupuncture, but it's not really acupuncture. And the results of the study may say that there was a suggestion that perhaps there was a placebo effect. So maybe there's not a conclusive decision about whether or not real acupuncture was superior to what they call sham acupuncture, or perhaps the results were not, there was not a large number of people who benefited when they compared it to the control group. And the challenge is that when we look at these types of studies and we're discussing with our healthcare provider about these types of studies to decide what therapy might be right for you, we have to recognize that the placebo effect, which sometimes a healthcare provider may say, we think this is probably just as good as a placebo, which means not doing anything. Many people may be familiar with a placebo medication in medication trials, where one patient would receive, in essence, a sugar pill or a fake pill, and another patient would receive the real medication. And when there is a placebo effect, in essence, the placebo effect means that the person got better or had a benefit from the thing that was not real. So if you're in a medication trial and you have a placebo effect, that individual in the placebo group still has benefit, even though they didn't take a real medication. And so in integrative or holistic care interventions, when we're looking at, is there a placebo effect? That is something that we actually are looking for. The placebo effect, when it comes down to it, means that the body actually healed itself. the body was able to garner benefit, improve. The symptoms got less, the disease softened, there was a clinical benefit, even though nothing was done. So that means that the person by themselves, the power of their own body allowed their symptoms to soften or improve. So that is really what we want when we're looking at integrative therapies, because many of these integrative or holistic therapies support the body to heal on its own. And that's what we're really looking to do. So if we have a placebo effect from some of these therapies, that's not a bad thing. That means that the individual, their own body, is doing what it does best, which is healing itself, because our bodies have an innate power to reach homeostasis, meaning our baseline, where we belong. So a placebo effect is not necessarily a bad thing. It's actually a positive thing. When we're using something that's holistic or integrative, if we have a placebo effect, the person is healing and doing better. So that's positive. And it's really difficult to randomize and do a double-blind study on an intervention such as acupuncture. Because if an individual is receiving acupuncture, they're getting stuck with, where the acupuncturist uses needles. It's very difficult to fake that, as is many of the other mindfulness type interventions. Sorry, my light just went off. Okay, I'm back. And the other thing that we need to recognize is that these types of interventions are very effective for managing stress and improving well-being, or a sense of well-being. So whether or not the intervention can have an impact on a specific symptom, that's amazing. But if all they do is help the individual manage their stress and improve their sense of well-being, then that's an amazing outcome, because when you peel away all of the layers, dealing with a cancer diagnosis is incredibly stressful, and it has such an impact on well-being. So anything that we can do to enhance a sense of well-being and manage stress can be beneficial. And everyone experiences stress. So people who are not affected by cancer will deal with stress day in and day out. And there are different types of stress, all which carry physical and mental health risk. And I think everyone here today, whether you're impacted by cancer or not, can attest to the increase in stress over the past several years. Stressors may be one time or for a very short period of time. Maybe something tragic happened, or maybe there's a stress at your job, which is short-lived, or it could be something that is more long-term, such as a cancer diagnosis. And many people cope with stress in different ways. So some people have an innate ability to deal with stress and let it just roll away. And other people struggle a little bit more. And there's no right or wrong way to deal with stress. It is whatever resonates with you, whatever your way of dealing with your stress. If it's a healthy way and dealing with the stress doesn't cause you more stress, then that's the right thing to do. And we recognize that cancer in and of itself is extremely stressful. So anything that we can do to help with that stress can be beneficial. I do want to mention the effect of stress on the body. So when we feel stressed, any kind of stress can cause a physical reaction in the body. So when we are stressed, we typically will engage our fight or flight response. So, perhaps you woke up late to go to work today, and You overslept, the alarm clock didn't go off, you woke up and you had a big meeting at work. So now you start the day off and you are extremely stressed trying to get out of the house. In that moment of waking up and realizing that you overslept and you had to get to work because you have a big meeting, your heart rate increases, your blood pressure increases, your belly has a decreased blood flow, because as you're trying to get yourself ready to get to work and get to that big meeting, the last thing you need to do is think about eating. So your body innately decreases the amount of circulation that goes to your stomach. And your blood vessels are constricting, which will increase your blood pressure, which is designed to help you in this fight or flight response to get out of bed, get to work, and then engage in your meeting or presentation. And that is the same response that would happen if you were in the woods and you encountered a bear. And if you are in the woods and you encountered the bear, your body goes into fight or flight. So your blood pressure increases, your heart rate increases, your hormones change, your body secretes more glucose and insulin so that you have energy to run away from the bear. So whenever that happens, whenever there is stress, there is always a physical response. So you can see the slide on the screen shows a wide number of physical responses that occur to stress. So anytime we feel stressed, our body will respond. Some people have a slightly different fight or flight response, but in essence, everyone who experiences stress that's not managed will have some of these symptoms that are related to the body system that is affected by stress. Hormones, your mood, your heart rate, your blood pressure are all affected. We also know that our stress response, which is that fight or flight response, needs to pass through the filter of our mind to occur in our body. So when we encounter something that is stressful, we know through looking at research and the way that and the physiology, we know that if you have the ability to filter out stressful thoughts, you can have a positive impact on your body. And some of the interventions that we're going to talk about today can help with that process, can help filter out some of the stress that you're experiencing in your mind to prevent it from having a physical response on your body. Because there is a strong connection between the mind and the body, I'm going to ask everyone who's participating today, you see there's a nice picture of a lemon there. If you may, if you're not driving or operating a forklift, if you're in a safe place, I'm going to ask you to gently close your eyes and take a deep breath. And as you breathe out, I'm going to ask you to picture in your mind a lemon. A lemony lemon that's so juicy and sweet. And if you took a deep breath, you can smell the scent of the lemon. And if you can imagine that perhaps you take that lemon and you slice it, and some of the juice trickles out of the lemon. And then if you were to take a piece of that lemon and stick it in your mouth and feel the lemon juice drip down the back of your throat. And I'm going to ask you to open your eyes and take another deep breath in. And because we're on a meeting that I can't see all the people that are here, I would normally ask everyone in the audience, did you feel a difference in your body? And some people will say that when they imagine just the thought of a lemon, that they have an increase in saliva and they can feel the back of their mouth kind of tense up with that, a little bit of a pucker. And that is a normal response to just thinking about a lemon. It's like if you think about a food that your mom used to make for you when you were younger, you can almost sometimes taste it, and maybe you might get a little hungry. The body responds to thoughts. So just the thought of a lemon or just the thought of something that you love eating is enough for your body to start to become prepared to actually eat something. Because your body, that connection between the mind and the body is so powerful. There's also a lot of research on the value of breathing. So research has shown that mindful breathing has the ability to decrease the physical effect of stress on your mind and your body. So just taking a mindful breath, breathing in and breathing out very slowly and mindfully has the benefit or the effect of lowering your heart rate, lowering your blood pressure, and making you feel more calm and focused. We know that changes in your body can affect your breath. So if you were out walking really, really fast, and your body needs more oxygen because you're walking or running or exercising, naturally, your respiratory rate, your breathing will get faster. And we know that changes in your mind can affect your breathing. So if you're sitting here now and you were to focus on your breathing, you can, in a mindful way, slow down your breathing. If you notice that you are breathing a little more quickly, you have the ability to breathe at a set rate that's under your control. We also know that changes in your breathing can affect your body. So if we slow down our breathing, the next thing that happens in your physiology is that your heart rate can slow down. And we know that there is a connection between your breath and your mind. So changes in your breathing, if we engage in taking some nice deep breaths and focus on our breathing, that in turn can lead to a more calm mind and allow us to feel more centered and focused. So it really is quite amazing, the connection between our mind, our body, and our breath. And that is why so many of these holistic interventions can be so helpful for people affected by cancer, as well as for anyone affected by the stress of day-to-day life. We also know that there are challenges with inflammation, and inflammation is considered sometimes a hallmark of cancer. And there is evidence that inflammation may both promote tumors, make them worse, or it can also lead to a decreased severity. So inflammation is your body's response to something that doesn't belong there. So if you consider that maybe you get a mosquito bite, what happens when you get that mosquito bite? There's redness and swelling, and that area is a little bit itchy. That is because your body is responding to something that doesn't belong there, that insect bite, and whatever the insect injected into your skin when they bit you. That leads to inflammation. When there's something that doesn't belong in our body, so perhaps the cancer, depending on what type of cancer it is, the body responds with an inflammatory reaction. So there's inflammation that's caused because of the presence of cancer. In addition, chronic inflammation may be inflammation that's caused by smoking in the lungs, can lead to giving you an increased risk of having cancer wherever that inflammation occurs. So whether it's inflammation in the colon that may enhance the risk for colon cancer, or inflammation in the lungs that may lead to an increased risk for lung cancer. Inflammation and cancer are very closely related. And there is a lot of research in the world of the relationship between cancer and inflammation. So there's this complex relationship because inflammation is innately positive. If we didn't have the ability to generate an inflammatory response, our immune system wouldn't be working the way that it should. So inflammation at its baseline is good. We need to have inflammation. But when inflammation goes haywire and it is not controlled, that's when there's either an increased risk for things like cancer, as well as an increase in many of the symptoms, such as pain associated with cancer or its treatment. So anything that we can do to soften the inflammation and keep it at bay can help with the cancer treatment, as well as managing the symptoms of cancer. And that's where integrative therapies actually come from. That's why we here at Mather are running an integrative program to try and help our patients with some of these symptoms that they might be experiencing. So we're going to go through some of these interventions that may be helpful with stress, enhanced self-care, as well as trying to help with some of the inflammation. So acupuncture. Acupuncture is an amazing intervention. So with acupuncture, the acupuncturist who is licensed and credentialed to perform this intervention, they will use needles, heat, sometimes cupping, sometimes some massage, some essential oils, and they utilize the acupuncture points in the body to help with some of the symptoms and to enhance well-being. Acupuncture is based off of traditional Chinese medicine, and it has been around for thousands of years. And it is extremely effective for many, many symptoms, as well as to help balance spiritual, emotional, mental, and physical health. There is a lot of evidence, especially from the National Cancer Institute, for the use of acupuncture. So as we talked about earlier, maybe discussing these types of interventions with your provider, there is a lot of research on the value of acupuncture, and it is overwhelming the amount of support for the use of acupuncture to help with pain, whether it's after surgery, muscle and joint pain from aromatase inhibitors, muscle and joint pain that cancer survivors may encounter, chemotherapy-induced peripheral neuropathy, as well as other symptoms like hot flashes, fatigue, dry mouth, nausea, vomiting, and insomnia. So many, many benefits from the use of acupuncture. And I can, speaking personally for myself, I've received acupuncture. It is so calming, and you feel so good after a treatment. The next intervention we're going to talk about is aromatherapy. Aromatherapy is the use of essential oils, so things like lavender, mandarin, peppermint, frankincense. Essential oils that are used to target specific symptoms and to promote physical, emotional, and spiritual well-being. The goal behind using aromatherapy is to enhance relaxation, soften the perception of pain, soften the perception of nausea, help with the inability to sleep, as well as the distress that people feel when they're worried. And we use a lot of aromatherapy in the hospital, and we get such good feedback from our patients who are offered aromatherapy to help support them in managing their symptoms. We always get the question, well, how does that work? And is it, the question of it being a placebo comes up quite a lot. So the primary way that aromatherapy works is when you're inhaling. So aromatherapy through inhalation, meaning that you're breathing in a specific scent. So we'll take lavender, for instance. If you're breathing in lavender, the particles of the lavender essential oil, as you can see from the picture, go into the nose. And when those particles are combined in the air and they go in through your nose, there is a nerve that is in your nasal cavity called your olfactory nerve. And that olfactory nerve, as you can see from the picture, is connected directly to the limbic system of your brain. And the limbic system in your brain is responsible to help you with memories and emotions. So when you inhale something that an essential oil or a scent, that automatically connects to your limbic system, your memories, your emotions, and it can have an immediate effect to help you feel more calm and relaxed. Very similar to the idea that if you walked into someone's home and they were making something that your mom used to make for you when you were a small child, and you smelt that, automatically you're transported back to that time. And if you have a fond memory of whatever that scent is, automatically you feel more connected, more calm, and that memory is top of mind for you. In addition, your sense of smell can also have the power to warn you. We all have probably experienced taking out a carton of milk from the refrigerator and maybe the milk had soured. And when you smell that, automatically you're repulsed and you know, don't drink that milk. So your sense of smell can help you feel good, as well as it serves as a warning so that you can avoid things that are not good for you. Yoga is another mind-body practice, and I do say practice because it's something that we need to practice consistently. As you can see from the diagram on the screen, this actually came from the National Cancer Institute at the NIH, and they are advocating, the NIH advocates for yoga for people who have brain and spinal tumors. Yoga is extremely beneficial to help the person who is practicing connect their mind to their body. It uses a connection between your breath and your movement. So every movement is done with a mindful breath, and it is extremely beneficial to help with muscle aches and discomforts. It can be extremely helpful. Sorry, my light keeps going off in here. Extremely helpful for people to feel a sense of calm and relaxed, and to be connected and to know what's going on in the body. And when you are a person who is experiencing cancer, or if you've been affected by cancer in any way, it is really important to have that connection between your mind and your body, to know what your body feels like when it feels good. And when you can do that, you can recognize what your body feels like when something isn't right. And so it's extremely helpful. The practice of yoga can truly support that and allow you to have that connection between your mind and your body. As you can see from the picture, and I do want to preface this, I do not encourage anyone to do yoga without a yoga therapist or a yoga teacher who is trained in the safe use of yoga, especially for someone affected by cancer. Always make sure that you are learning yoga from someone who is knowledgeable about which poses are helpful for someone who has been affected by cancer, and which poses may be something that you might want to avoid. So I would not tell anyone to just go out and do yoga without some type of connection to either a yoga therapist or a trained yoga teacher. But as you can see from the picture, yoga can be done on the floor or modified in a chair. So often we'll hear from our patients that they're apprehensive to do yoga because they're worried about getting on the floor. I've heard people tell me, if I get on the floor, I'm never getting up. But you need not worry because all yoga can be modified. So whether you've been doing yoga for many, many years and you're extremely flexible, that's amazing. But if it's something that's new to you, all yoga can be modified and can be started in a chair. Very gentle. And it's the practice of yoga that's beneficial. So there's no need to worry about getting to the point of doing a downward dog for 20 minutes. We're looking for that connection between the mind and the body. Another wonderful intervention is Reiki. Reiki is an energy therapy. It affects our biofield. It can be used to enhance relaxation and well-being, and there are no contraindications to the use of Reiki. I typically will explain to my patients that Reiki is extremely beneficial because we all know that there is an electrical energy that runs through our bodies. So if I were to put EKG leads on your body, on your chest, we would see that there's electrical energy that flows through your heart. If we put leads on your head, we could see your EEG, the electricity flowing through your brain. If we put leads on your legs and we looked at an EMG, we could see the energy that's flowing through the nerves that are in your legs. So we all have electrical energy that flows through our body. A Reiki practitioner will use their own energy, their own biofield to help balance the biofield of the person that they're treating. And it is extremely relaxing. And when patients come out of a Reiki session, you could see someone go in very tense with their shoulders up around their ears, and they come out and they're relaxed and calm. So it's really very helpful. Meditation, there is a lot of research on the value of meditation, calming the mind, feeling more at ease, more at peace. Meditation truly connects your mind and your breath. Mindfulness-based stress reduction, I believe, has the most amount of research available. So if you look at MBSR, mindfulness-based stress reduction, on the NIH website, there's a lot of research that has gone in to the value of meditation, whether it's guided meditation with a recording or mindfulness-based stress reduction where people are working individually. It's not all about clearing the mind. So often people will think that meditation needs to be, you need to sit with an empty mind, which is really challenging for many. But it's more about acknowledging thoughts that come through your mind and addressing them without judgment and letting them pass. And then recognizing that no thought is bad. It's how we respond to our thoughts. And meditation is extremely calming and beneficial for any and all people. For those people that maybe struggle with sitting still for a long period of time, labyrinth meditation is extremely helpful. The picture that you see here is the portable labyrinth that we have here at Mather. We're very fortunate that we were able to bring this to our organization. This is set up in one of our conference rooms, and it's very serene and peaceful to utilize the labyrinth. And when people use the labyrinth, it can be an individual or a group exercise. But as you can see, there's one way in, which is what you see kind of towards the bottom lower right of the screen next to the two bigger candles. And you walk into the labyrinth and in a mindful way, focus on something that you either want more of, whether it's joy, calm mind, a healthy body, focusing on what you want more of. And as you walk through the labyrinth, every twist and turn is an opportunity to pause, take a deep breath, and focus on whatever it is that you're entering the labyrinth with, either something you want more of or something that you would like less of to leave behind. And when you get to the center, which is that little scalloped area in the middle, that is a final opportunity to let go of what you don't want or take in more of what you do want with a few mindful breaths. And then you leave the center the same way that you got there. Again, in a very focused and mindful way. So it's, in essence, I look at it as a moving meditation, and it is extremely calming, and people feel much better after doing a labyrinth meditation. Hypnosis is a state of focused attention, typically done by a hypnotist, where they provide suggestions for positive change. The hypnotist allows you to access your other than conscious self for those suggestions. Clinical hypnosis is beneficial for discomfort as well as to enhance a healthier lifestyle that may in turn lead to maybe a better response to treatment, whether it's stopping smoking, losing weight, for stress, for pain. And the ultimate goal in doing hypnosis is to actually learn self-hypnosis so that you can do it for yourself. And then if that's, once you learn how to do it for yourself, it's something you can carry with you for a long time. Our team here at Mather has training in an intervention known as CBTH for fatigue, cognitive behavioral therapy with hypnosis for fatigue. This was actually the focus of a study done by Mount Sinai Medical Center, and this intervention was demonstrated to improve fatigue in women who were undergoing radiotherapy or radiation for breast cancer. It's about a 6-week intervention, and it combines the elements of cognitive behavioral therapy along with the concept of hypnosis and teaching patients self-hypnosis. And it led to the participants in this particular study to actually having a decrease in their level of fatigue. Another thing to be mindful of is goal setting. So often we encourage patients to identify what goals they have. So when you're looking at utilizing an intervention, whether it's acupuncture, hypnosis, meditation, Reiki, what are the goals? So are you looking for management of a specific symptom? Are you looking for enhanced well-being? Do you have a specific physical goal, whether it's walking 100 feet or running a marathon? Or is it a personal goal, maybe attending a wedding or a party? Trying to identify what your goal is can be very helpful in structuring the interventions that you'd like to apply into your day-to-day routine. Knowing what that goal is can be really empowering. Journaling can also help enhance that goal setting process, as well as to help us feel more in control. So journaling takes worry out of the mind and puts it down on paper, and can really be helpful for people who are trying to identify a goal and work towards it. Also, I'd like to mention the value of sleep. So ensuring that people get a good restorative sleep can help enhance the immune system, increase clarity, help with coping, as well as enhance a feeling of well-being. And many of these interventions can help people get a high quality sleep. Also, exercise has been demonstrated long-term to affect the immune system. There was a study that was done on aerobic exercise and pancreatic cancer, where exercise increased the overall survival rate for patients who were experiencing pancreatic cancer. Nutrition is also something that's extremely important for individuals who have been affected by cancer. A lot of studies on the value of an anti-inflammatory diet. And, due to time, I'm not going to go too much into it, but it is important to ensure that you're getting in the right nutrients and that you're leaving out things that are inflammatory, such as processed foods and things that are not going to support your overall level of well-being. The NIH tells us that healthy diet and exercise together can help support a longer, healthier life. And from the NIH, or National Cancer Institute, when the question was posed, how much movement should I be doing? Their response was, move as often as you can, whenever you can. Motion is lotion and movement is medicine. So we're often posed by many patients with questions when we talk about interventions like we've been discussing today. Where can I actually access some of these interventions? So I do want to take just a few minutes to share with you one of our most exciting programs here at Mather, which we call Renew. Restore, Nurture, and Empower Women. So this program is funded by a grant through the Northwell Katz Center for Women's Health. And through this program, we're able to offer the interventions that we've discussed today. This program is at the moment only for women affected by cancer because of the grant funding that we have. However, we're collecting information to help support continuation of this program for all people who have been affected by cancer. The program currently runs every Thursday right here at Mather in our conference room 1 and 2 Integrative Care Center. And we are collecting feedback from all of our participants on what the best day, time, location is for our participants to be able to access all of these interventions that we've been talking about today. So we do have a couple of minutes left for questions. So I'm just going to unshare my screen and I'll be able to take some questions if anyone has some. Okay, so I'm looking at the Q&A and we have a question here. I'm a pharmacist at Mather, interested in holistic health. How can I contribute? Oh, that's a wonderful question. We would love to have any and all of our community of healthcare providers here at the hospital help us with the pursuit of integrative and holistic health interventions. And if you contact me offline, you can send me an email and I would be happy to discuss how we can how you can help us to help our patients. Thank you.
Hey, Dr. O'Brien.
Thank
I think
you.
we'll give it a few seconds, see if anybody else has any questions.
Thank you. And just as a reminder to throw it out there, if anyone is interested in our Renew program, so the program for women affected by cancer, so either active cancer or cancer survivors, we offer this program every Thursday. And if you contact the hospital, so the phone number is 631-476-2803. And you would hit option 1, and that's going to take you right to patient access, and patient access will schedule anyone that's interested for an intake visit. So that's a one-on-one telemedicine appointment with a nurse practitioner from the Integrative Care Center, and we'll review what you're experiencing and how the interventions can help you to feel better. And then we can schedule you to actually come to the space to try out whatever intervention resonates with you.
All right, sounds good. Thank you, Dr. O'Brien, and thanks to everyone for joining us today. If you have any additional questions, please email them to matherhospital@northwell.edu, Once you exit the webinar, you will see a link to complete a brief survey. If you could please complete the survey, your feedback is extremely important to us and helps us plan our future programs. Thank you all for joining today's webinar. If you'd like to view other HealthyU webinars we have presented, you can find them at www.matherhospital.org/HealthyU. Thank you again, everybody.
Thank you.